Okay, hi guys. There's been a lot of issues online, I think, lately. I want to speak about the extension on the Pfizer vaccine, the extension on the expiry date, and I thought I should maybe go back also and talk about expiry dates, talk about stability data, talk about side effects, and how it's different to an adverse effect. And I think also it's worth mentioning something about contraindications. What are these things? So, first things first, I'll speak about what an indication is. So, into eyenzekayo, la magama ngawethu, in the sense that they belong to, this is medical jargon, right? So, there's how you want to use the word, how you understand it as the layperson, how you use it with your friends. And then there's how I'll say we, right? Just to make myself feel important. How we have come up with the words and what we've prescribed the words to mean, when they should be used and how they should be used in the medical field, right? You could be an engineer, a lawyer, an accountant, and maybe you have a similar word, but for you it applies differently, right? So I need to tell you how we use the words, and we take it from there. So an indication is how a particular medicine, what it is used for, right? So you could have an antibiotic that can be used for a urinary tract infection. It can be used for a stomach infection. It can be used for pneumonia. So we say it has multiple indications. There's many things that it is used for. And with these different indications, it could be used at a varying dosage or a dosage frequency. So if you're using it for one thing, the person must use it just once a day. If you use it for indication B, the person uses it at double the dose, 2 times a day. I'm making an example. If you're using it for indication number 3, the person uses it at 1 tablet a day, 1 tablet per dose, but the dosing frequency changes to 4 times a day, right? Also, the duration of treatment might change, where for one indication, the duration of treatment is 5 days. And for the second indication, the duration of treatment is 2 weeks or a month or longer, right? So I want you to imagine in your mind that you've just discovered a molecule and you find that this molecule, you want to test it for something. So we call this efficacy testing. Someone said that this particular root or herb, right, which is a leaf or other, it helps for a particular condition. So it is indicated for this condition. Now, you must prove that it actually works for that. So we call this efficacy testing. You're going to call people into a room and you're going to have something called drug trials, where you give them this medicine and you see that it actually has done what you intended for it to do, right? This is when you start to determine we'll do another video where we talk about minimum effective concentration, maximum effective concentration, toxicity, overdosing, and those kind of things that would come up with the drug testing. But for purposes of this video, I'm just going to talk about side effects. So of the people that you are giving this medicine to, you have to report what they feel like, right? So you have now these journal articles or files for each patient, who they are, what they ate, when, did they have any other medical conditions before the trial started, did they have any medical conditions that developed during the drug trial. So you will start recording. So we said a side effect is an unintended effect. It can be positive, it can be negative, and we can control it, right? Symptoms can develop while taking this medication. They can happen at normal recommended doses, and they're unrelated to the intended purpose of the medication. So I've said that they can be sometimes positive, sometimes they can be negative. A person might use an antihistamine because they want to sleep. So it's beneficial to them, that side effect. But someone who's a long distance driver and you give them the antihistamine and it's going to make them drowsy, that's not a good side effect for them, right? If you are giving someone a medicine that could lead to weight loss and this person is diabetic, hey, that's a good side effect. We have something we call off-label use or off-label indication. It means that this medicine, after the drug trials, was approved by the Regulatory Council. In South Africa, we call that council SAPRA. It means that it was approved for or indicated for a condition A. However, doctors, pharmacists, and others know that that molecule can help for something else as well, but the medicine is not registered for that use. So, meaning that pharmaceutical company that makes it bears no legal responsibility should you not use it the way that they said that medicine is intended to be used. But pharmacists, doctors, we do that anyway, and we call this off-label use. So I've talked about an indication. What is an indication? I've talked about how during the drug trials, you will find and record side effects. It's an effect of the medicine. You did not intend for the medicine to do that, but it does do it anyway. Then we talk about an adverse drug reaction. An adverse drug reaction is similar to a side effect in that it is unintended. However, adverse drug reactions are almost always harmful or negative, right? By comparison, side effects are generally bad, but they can sometimes be neutral or beneficial. More specifically, adverse reactions are defined by the WHO as a response to a medication that's harmful and unintended. They also tend to happen at normal doses and during normal use. This means that you could be taking a medication like you should and still experience a bad reaction. If you experience an adverse drug reaction, you're generally told to stop using the medication or to use a different dose. If I gave you an antibiotic and you have a side effect of nausea, or you're using metformin for diabetes, I could say, take it with your meals, take it with food, and that would mean it lessens the side effect. Sometimes when people start treatment, someone starts their ARVs and they experience bad side effects. Nausea, vomiting, diarrhea, hallucinations, very vivid dreams, bad dreams. But with consistent use, you find that after a couple of months of using this medication, this patient becomes tolerant to the side effect in that it's no longer there. Or like I said, you could advise certain ways that they could avoid the side effect. Blood pressure medicines that we call diuretics, they make the person wee quite frequently. So the patient now finds that they can't sleep at night because they have to get up and go pee every so often. But if you advise them to just take the medicine earlier or no later than 2 or 3 p.m., then you've kind of solved that. With an adverse drug reaction, you're usually not even expecting it to happen. And it is negative, and there's usually nothing you can do about it. It's not a matter of if you take a lesser dose, that sort of thing. I'll make an example with someone who is on nevirapine or cotrimoxazole, where they develop a bad rash because of this medication. And if they continue taking it, the rash just becomes worse and they get something called Stevens-Johnson syndrome. And it looks like there's something that's eating away their skin. They eventually need hospital admission. And depending, right, they could actually die from a bad skin infection that ends up becoming systemic, and that's generally the difference between a side effect and an ADR. What happens then with people is they're using the side effects to say, I cannot use this medication because of its side effect profile, or to make it seem like, this thing is so bad because it has 100 side effects. But if you remember, we talked about someone who wants to register in medicine and did these drug trials. They usually have about 2,000, 3,000, 8,000 people that are in the trial. And you will then have to do some statistics, right? To say, okay, 10 people reported headache, 100 people reported nausea, 1,000 people reported blurred vision. I'm making an example. So eventually at the end of the trial, you will have rare side effects. You'll have very rare side effects. You will have common side effects. And usually this is not written in the package insert, unfortunately, or the patient information leaflet. But with our textbooks, our pharmacy textbooks, and with the experience that a doctor or pharmacist has of dealing with patients, they usually then start to know which side effects are serious, which ones are not, which ones to expect, which ones are not so common. But if you're just reading a list of 100 side effects, it seems like all these 100 things are going to happen, and it's not true. Of those 100 side effects, you might only experience one, right? You might experience 5. I'm making an example. A side effect is not always going to happen, but it's just when it happens, we're not surprised because we did expect it. It is a common side effect, and the pharmacist will warn you of these before you start the treatment. It's not something for us to shout about, and start telling people that this medicine is not safe and so forth. The regulator has made the pharmaceutical company to list the side effects in the package insert or the patient information leaflet. So at best, the patient is aware. What we should be scared of and what we should be vigilant about is people who are saying that their products do not contain side effects. We don't want to ever hear that. Everything we take will have some kind of side effect. I want to then talk about 2 words, correlation and causality or causative effect. When the side effect happens, the team that works with that pharmaceutical company or Luanda who decides to manufacture a product, of those listed side effects or of those reported side effects, they have to sit and work out the correlation. How do these side effects relate to using the medication? Or was it something else? Is it because the person is it another variable, right? And we start talking a lot of maths and statistics. So correlation speaks to a statistical relationship between one variable and the next. What is the relationship between using this medication and the reported adverse event or adverse reaction? I'll make an example. We had a scenario where just before a lady was vaccinated, before the needle goes into the arm, she then collapses and has a stroke. That's an adverse drug reaction, right? Because it's not necessarily, it's an adverse event, sorry. So this was not the actual medication that caused it. It's not a side effect, but it could happen during your trials where someone did have a stroke and you might have reported it. And then you need to work out what is the correlation with that. How many times did it happen? Then you could have what I'm saying about causality or causative factor. This effect is directly caused by using this medication. Another example is how oral contraceptives are linked with high incidence of STIs, or more particularly a candida infection or vaginal thrush. So when someone is using oral contraceptives, it's maybe safe to assume that this person is not using condoms because they are on oral contraceptives, meaning they're having unsafe sex. And if more people on oral contraceptives are reporting to you that they have STIs, is it the medication that's causing them to have STIs, or is it because when people are on an oral contraceptive, they are then less aware, less scared about not using protection, and then they end up having STIs, right? So someone who's not on a contraceptive most likely is using barrier protection vis-a-vis they're using condoms, and they're not going to get an STI. But then you could find that listed in the list of side effects of using a contraceptive is that you're likely to report having an STI. That's what we're talking about: correlation, causative, and how there could be multiple ways to explain how that side effect lands up on that list. Lastly, you have now this medication, and there's what we call a contraindication, right? A contraindication are symptoms or conditions that make a particular treatment or procedure inadvisable. In the context of pharmacology, we usually speak of contraindications when the regulatory authorities who assess drug safety and license the sale of drugs have required the manufacturer to specify this. It means that because you are who you are, of your genetics, of your particular makeup, you are not compatible with this surgery, you are not compatible with this medication. We cannot do this surgery because your platelets are low. If your platelets are low, this medication is going to deplete them more, you're going to become anemic, and you're likely not to recover. So we cannot do this procedure. It's contraindicated. So we talked about an indication, remember earlier? And now we are saying contra, meaning against, something that is against that indication. We cannot indicate this treatment for you. We cannot recommend this procedure for you because you are pregnant. If we give you isotretinoin, which is an acne medication, it might hurt your baby. We call this teratogenicity, meaning the baby might grow with some deformities in the womb, and by the time the baby is born, they then show these deformities because of that medication. So we do not give it in pregnancy. It's no longer a matter of side effect. It's no longer now an adverse reaction, adverse event, side effect. It is a contraindication. Do not give this to pregnant people. Do not give this to someone who's breastfeeding. Contraindication. Do not give this to a diabetic. Do not give this to a baby that's below the age of 1 month. Do not give this to a baby that's below the age of 6 years. Contraindication. I don't want you to get lost in the jargon, okay? The contraindications are sometimes relative contraindications, and sometimes they're complete contraindications. Relatively, based on safety. If the doctor, pharmacist, and the team decide that the risk associated with the use of this medication is not so much compared to how this patient might benefit if we did continue with treatment, or if we did do this procedure, when the benefit outweighs the risk, that contraindication might be waived, right? But it's waived by someone who's making an informed opinion, and they overlook it and they still continue to give you the treatment, or they continue to do that procedure. A complete contraindication means that no matter the circumstance, just do not just to not give this particular medication. Now, when it comes to contraindications, here you are allowed to make all the noise and tell your friends, tell your neighbors, and say, never use this medication for if you are if you have asthma. Never use this medication if if you're below the age of 18. And there's many other contraindications. We don't use antihistamines for children below 6, but that is a relative contraindication. We do sometimes give to even 1 or 2-year-olds. Do not confuse the contraindication for a side effect. A side effect can be serious, can be mild, but generally they are not what society understands them to be. Contraindication is where you quickly want to go and look when you look at that package insert and see that you are not taking something that you should not be. To answer whether or not I'm supposed to take this, looking at side effects is not where you should be looking. Because if we did that, I don't think any of us would take medicines, right? There's always going to be a side effect. You worry about the contraindication. The last bit is when now you finish the drug trials and your medicine should go to market. It now must be sold from pharmacies, etc., etc. You do something we call a stability study. You want to know how long can my mixture sit before it decomposes. I'm using the word loosely. So we look at microbiological data, meaning are there any chojos that grew while I've got this thing bottled. Stability data will tell you if you should be using a glass bottle, should you be using a plastic bottle, can you use a clear bottle, or should you use a amber glass that will prevent UV rays from coming into the bottle, so the brown ones, right? Almost like beer. There's a reason why beer is not in a clear bottle, why they're brown or green. How much pressure this medicine should be in. As soon as you open it, you might release the pressure, and if you have, how soon should you use it after you've opened it? You've seen this, right? Where the bottle says use within so many days after opening, because we can guarantee stability as long as it's in the original packaging and as long as it is stored the way that we said it should be stored. But as soon as you change any of that, we can no longer guarantee stability. Or it says, you have a tomato sauce that you find in the aisles, right? I'm making an example. I'm not even sure if it does say this, or mayonnaise. And then it says, once you've opened it, you must refrigerate. But then before, you didn't need to because it was in the original packaging. And their stability data shows that you can have it in the original packaging for so many months. And if that changes, then please refrigerate, because the physical chemical properties will change. I hope you understand. I hope you are with me. What I wanted to say here is you do something called accelerated stability. So you sort of create a fake environment to see if you raise the heat too much or lower it too much. How would the product react if you exposed it to a lot of light, some humidity? What would happen? So you are over 6 months trying to extrapolate how the product would perform over a period of a year, 2 years, right? And from there, you extrapolate it, you come up with a shelf life, and you give it a shelf life of X. However, yes, the product can go to market with accelerated stability data, but you are keeping samples that you are keeping in real time and trying to see what really happens, because the accelerated stability data is sort of saying what could happen, and it's accepted. You might find that your shelf life with the accelerated stability is 2 years. I'm making an example. And if you kept a batch for 2 years and then tested it after that 2 years, 2.5 years, 3 years, you now have a chance to adjust your expiry date and say, actually, yes, the stability data showed me X, but if I really kept it for longer, I now have evidence that shows that the product could still have an extended shelf life. We have something we call stability samples. So every time after we complete making a batch on the line, we will take a sample at the start of the batch, and we have something we call a middle sample, and something we call an end sample right at the end. So start, middle, and end. These samples the company will keep, and they can perform stability data on them whenever they like, whenever the requirement does arise. We are then able to call pharmaceutical companies and ask for an extension on the expiry date, because we know they are performing this stability data on every batch, and then they will say, fine, we have actually done the stability data in this particular batch. You can extend the expiry date for 1 month, for 2 months, for 3 months, depending. It's been happening. It's not something that's just happening now with Pfizer.